tell me about your referring endodontist, periodontist, or oral surgeon, or other specialist in your area? Would you say your communication is tight? Is it so-so? Do you have detailed methods of exchanging patient information with these doctors at all? There's often no such system in place with the specialist we refer to. And if you're not doing this, it can have a negative impact on your patient's health, your schedule, profitability, and very importantly, your reputation. Let's say you refer a root canal to a nearby endodontist. He does the procedure and leaves the patient with a temporary filling. If you don't have a systematic method of follow-up after that treatment, you could be missing opportunities to get the permanent crown done. You also have a patient living with an unstable tooth that could break, and that's not going to look good for either you or the endodontist. So here's how to strengthen that relationship. First, set up coffee or lunch with each specialist you typically refer to. Ask yourself, is this someone I even want to be referring to? Does this specialist have a personality that fits the vibe of our practice? Better yet, invite your preferred periodontist to your practice over lunch. Have her spend some time with your team explaining exactly what she does. This way, when it's time to refer a patient, your entire team will be better able to tell the patient what to expect. Remember, your patients draw a direct line between you and the specialist you refer to. They may look at you as partners in their treatment. Step 2, when you meet with each specialist, define the specific step-by-step method of how you'll communicate. Here's how that workflow might look. You'll keep referral pads for the specialist in your office, which include teeth numbers and areas of concern. Each time you refer a patient, you'll fill out a referral slip, scan it into your doc center, and send the slip with any radiographs or appropriate records with the patient to the specialist. A good customer service gesture here, offer to make the call and schedule that root canal for them. Making the call for the patient removes the roadblocks to treatment. Mrs. Jones, I'd like to set up an appointment with Dr. Brown to take care of that root canal. He's the best in town. We send all of our root canals to him. When he completes it, you'll need to come back here so we can stabilize that tooth with a permanent crown within a couple of weeks. Now, schedule the follow-up crown. Would you prefer Tuesday the 12th or Thursday the 14th? And do you prefer mornings or afternoons? Finally, the financial agreement removes any doubt that the crown is all they'll have to pay for. Remember this form from our treatment planning video? This is the perfect use for it. Step 3. Some patients won't agree to let you schedule the appointment with the specialist. You're in a bit of a danger zone here because you're likely sending her away unscheduled for the ensuing crown. In these cases, you should have an agreement prepared with the specialist. When the patient goes in for the root canal, the specialist will send or email a letter to your practice specifically detailing the treatment they performed on your patient. That letter might read, "We completed the root canal on 31 for Mrs. Jones. We've placed a temporary filling and she's ready for the crown." When you receive that letter, call the patient and schedule them for that crown. Scan that letter into the doc center because this case will inevitably come up in a future huddle and the doctor will likely want to see that letter. Since you've already conveyed the importance of that crown with the patient, here's what you say when you call her to schedule it. "Mrs. Jones, we received a letter from Dr. Brown indicating your root canal was performed. I wanted to see how you were feeling and make sure everything is okay. Remember how we talked about getting that permanent crown put on? I also want to make sure to get that scheduled. And use that rule of 2, Tuesday or Thursday, morning or afternoon." And that's it. Make sure to set up a face-to-face meeting with your referring specialist. Be sure they're the type of personality to whom you want to be referring your patients. Be certain your preferred specialists understand your method of referring patients. Be sure specialists communicate treatment via email or letter, confirming the referred treatment has been completed. This kind of detailed communication, both within your practice and with your preferred specialists, helps ensure no patients or treatment falls through the cracks.